And today we're going to see the nurses, vocabulary related to nurses. And as I think that you already know, nurses, the word that we use in Spanish to refer to these workers. Here in the presentation, you can see a nurse with a uniform that is very traditional. Now there are different kinds of nurses. We have the student nurse, the staff nurse, the charge nurse, and the nurse manager. They are at a different level in their education and experience. So the student nurse, as you can see from their name, is a nurse who is still in training. So basically it's just still studying. The staff nurse is a nurse who has completed the training course. So a graduate nurse. They have finished their education or their qualification. That's why they can become part of a team, and they become part of a staff. And we have the charge nurse, who is a more experienced nurse, and she is in charge, usually a woman, is in charge of a ward. Finally, we have the nurse manager, who is even more experienced and can be in charge of several wards. So very simple. You can see the names here: student nurse, staff nurse, charge nurse, and nurse manager. There's an old word that is sometimes and in some places still in use, which is sister. Sister, or you can say the nuns, used to work or to help as nurses to provide patients care. That's why sometimes and in some cases they were called sisters and nurses. Now, in this expression, Dr. James is talking to Sister Smith. What she means is that Dr. James is talking to Nurse Smith. Okay, so as I told you, this word sister can be used in some cases and some places instead of the word nurse. Now, talking about other support workers, these workers support the work of the nurses. We have clinical support workers, nursing auxiliary, and ward clerks. So usually the first kind of workers, the clinical support, they are unqualified like nurses, but they have taken a short qualification, which is also a short course. It implies, that's what it implies. And they help nurses. The nursing auxiliary is someone who is not qualified, someone who has no qualification, but they assist nurses or the nursing team. And finally, we have the ward clerks. The ward clerks are the people who are in charge of keeping the information of the patients up to date. Okay, so those would be the ward clerks. Now, talking about the specialization of the nurses, we have three different kinds of specialization in the UK. The first one, well, in the UK and the USA as well. And the first one is the midwife. The midwife is a nurse who has taken a course and training in parturition and childbirth. So as you can imagine from the word parturition is giving birth. So that's their specialization, midwives. If it's a man, you could also call him a midwife, okay, if that's his specialization. District nurses, the meaning cannot be very evident or is not very evident from the name. But a district nurse is someone who visits patients in their homes because they cannot move, they cannot travel, or just because they have enough money to pay for a district nurse. And help visitors, even though the name says visitors, they don't visit particular patients. Their job is to work with communities, so groups of people. They promote health and also they promote the prevention of illnesses. Now, nurses have specific roles that are restricted to them, and they usually, or up to just a few years, they were not able to do some doctor's procedures. But what they have always been doing is taking care of the patient, taking the temperature, taking the pulse rate, the blood pressure, changing the dressings. Dressings, you don't imagine as dressing as a food or the usually what you put on a salad. That's not a dressing in this case. A dressing is the covering of a wound. So, for example, if I cut my arm and then somebody puts a bandage on my arm, that would be a dressing. Okay, and sutures are like stitches, but suture is the technical term. So now the difference in the past, or well, the difference between the past and the present in this case is that the role of the nurse has changed a bit. The purpose of changing what the nurse is allowed to do is to save the patient's time. Okay, so we're going to read this little piece of news from the Scotsman, which is a newspaper, and it is about the change in the nurse's role. So it says, nurses carry out surgery in effort to cut patients' waiting list. Nurses in Scotland trained to perform minor surgery have entered the operating theatre for the first time in an effort to cut patient waiting times. 5 nurses who have passed a new course at Glasgow Caledonian University are now qualified to carry out such procedures as the removal of small lesions, benign moles, and cysts. So, what it says here is that some nurses in Scotland have already been qualified to perform some procedures which were restricted only to doctors. Here we have some words that may be important: perform, carry out. Those are the verbs that we can use with procedures. Also, we have the operating theater, which is the room in which patients are operated. Okay? In English, they call it the theater. It's not only the place where you can go and watch a movie or watch a play, it's also the place where patients are operated. And we have some collocations with perform and carry out, which are synonyms, as I told you. We can perform an examination, an operation, a procedure, or we can also carry out an experiment, a test, or a biopsy. So those are some things that the nurses can do nowadays. Okay, so thank you. This is the end of this topic, and see you next time.